Data shows that 1 in 20 Americans will be diagnosed with colon or rectal cancer during their lifetime. That's 5% of the American population.
Colorectal cancer is still one of the top 2 or 3 leading causes of combined cancer death in the United States. And having a colonoscopy for this purpose is a very important way of not only diagnosing whether you have a propensity to develop this cancer, but also to be able to do something about it.
Colonoscopy screenings make it possible for a doctor to look closely at the inside of the entire colon and rectum. There in the lining is where polyps can develop.
During the procedure, we may identify a polyp, which is a small precancerous growth.
At MedStar Franklin Square Medical Center, Bill Hefner has arrived for his 8 a.m. procedure.
3 years ago, I had a colonoscopy, and they found a polyp, and that's why I'm back now.
Most people are afraid when they hear the word polyp. In general, polyps are benign growths. The whole idea is to catch colon cancer early before the polyp is even turned into a colon cancer.
If a polyp is discovered, most can be immediately removed through the endoscope using a wire snare,
which is like a little lasso around the polyp. Then tighten that lasso. Using cautery, which means heat, we can then seal any blood vessels and cut the tissue. The greatest concern that patients have regarding colonoscopy is probably the fear of pain. We use anesthesiologists and patients are put in deep sedation. So pain is not a factor. So once they realize they're not going to have pain during the procedure, the other concern is the prep.
Preparing for a colonoscopy means clearing out the colon to ensure a quality procedure.
If the prep is not performed thoroughly, one does run the risk of having to have a repeat procedure, because if we cannot see anything, the procedure is not going to be as safe and it's not going to be as effective. We might miss small lesions.
The day before their colonoscopy, they'll go on a clear liquid diet. They can go to work. We encourage them to drink plenty of fluids so they don't become dehydrated.
There are several options available for bowel prep. You should discuss them with your gastroenterologist.
The bowel prep that has stood the test of time is the old and sometimes not often looked forward to gallon jug of Go Lightly.
About 6 p.m. I had the mixture that on the prescription. It's a gallon, and you start taking 8 ounces of it every 15 minutes until it's gone.
Situations where patients cannot consume the gallon of bowel preparation, there are other preparations available. Some of these are, if one really does not want to take liquids at all, one can take pills by mouth. And this prep is where one has to consume about 32 tablets, 3 every 15 minutes with a glass of water.
The best way I could say it is it's inconvenient. It's you have to do it, and you just have to be very patient as the process is going on.
The next morning, they come to the endoscopy center, generally an hour before their procedures, so the nurses can talk to them.
We have individual bays that are private for everybody so that you are not exposed to other people, and take care of your privacy during that process.
They then have an IV placed, an intravenous line, placed in one of their arms. They're interviewed by the anesthesiologist, the other staff members. They're brought into the endoscopy room where they're given anesthesia.
It's 8:14 a.m. Bill is asleep, laying on his side, and the procedure is underway.
Most colonoscopies take 15 to 30 minutes. If somebody has a more difficult colon or multiple polyps, it can take a little longer. The procedure itself will coming again an hour to an hour and a half before your scheduled appointment, then having a half an hour for the procedure, and then having 30 to 60 minutes to wake up. You're at the endoscopy center for probably 2.5 to 3 hours.
Inside the endoscopy suite, Dr. Fleischer uses state-of-the-art equipment to look at Bill's colon.
The procedure itself is performed by inserting a flexible lighted tube called a colonoscope. It's got a video camera on the end of it, and it's got a few light sources that come through it, as well as a working channel through which instruments can be passed. The flexibility of these scopes is adjustable, and this can help facilitate passage of the scope through the colon. And we have high definition video source so that we can see very good images as we advance the scope through the colon.
Colonoscopy is the gold standard for early detection. Polyps are removed before growing into cancer.
Both men and women who reach the age of 50 should get a screening colonoscopy. If you do have other risk factors or a family history of colorectal cancer or polyps, one should start earlier.
There are other groups of people who need colonoscopies. People who have a long history of inflammatory bowel disease, such as ulcerative colitis or Crohn's disease. And then there's another group of patients who need diagnostic colonoscopies. Those are patients who are anemic or who are seeing blood in their stools or who have unexplained abdominal pain.
Mr. Hefner, just wanted to tell you that things went very well.
It's 8:45 a.m., and Bill's wife will soon be driving him home.
It enabled us to do a great procedure. We are able to inform our patients right away whether we detected these growths or polyps and whether we removed them. And there were no further polyps identified. But the actual type of polyp and stage, if anything more sinister like cancer is discovered, the tissue will need to be evaluated by our pathologists, and that result can typically take about 48 hours.
Right now, just a little bit of abdominal pressure, which is normal because the procedure pumps air up into your intestine, and that will dissipate probably today, and I was ready for that. A little groggy right now, but that's coming back. I cannot drive for 24 hours, and outside of that, I can now eat what I want, and everything's cool. The results were everything I was hoping for. It gives me peace of mind.